Business Trendsetter podcast, where we talk about trends and how to use them to grow your business. My name is Manny Turan.
And I'm Adam Hartung.
We are Spark Partners. We're here every week discussing trends and how they pertain to your company and your business and how to use them to grow your business. And we talk about current events. We talk a little bit about politics. We kind of go all across the board, but fundamentally, we look at what are the elements within trends that you can use to grow your business. And welcome back to the States, Adam.
Thank you. Thank you.
You were gone for a bit, and so I wanted to relay I had a situation last week with my son. Thought he had strep throat, so we went into the urgent care so that he could get swabbed and have the doctor look at him to make sure he didn't have strep throat and have to deal with all the antibiotics and so forth. So we went in and we got a person that asked us to, number one, scan a QR code to fill out the paperwork. So we did that. We sat down, we filled out the paperwork. Then it opened up a website for us to do that. And then they said, by the way, we don't have any providers on staff today. Would you be okay with us doing the swab? They did have technicians and nurses, but they didn't have an NP or a nurse practitioner or a doctor on staff. Would you be okay doing a telemedicine session? So we said, yeah. So we got taken to the back. He got swabbed. They went out to do the tests, the COVID, as well as strep. And while we were waiting for the results, I got basically a message on my phone. Clicked on the message. It took us to a website. And there on the other side was a provider. She was in Phoenix. She walked me. She had some questions for me and for him. She had me feel his neck. And long story short, didn't have strep, didn't have COVID. But what was fascinating is the entire situation was done remotely. You know, you and I talk about mobility and the ever increasing ubiquitousness of mobility in the world. And there it is, front and center. We were able to get quality care, and I think it was $100 in and out, or 120 for the whole deal. So I just wanted to bring that to light. And I know you had a recent event as well. So I wanted to talk about how maybe things are a little bit different across the pond.
Well, first of all, I'm presuming you have health insurance.
Yeah.
Okay. So you paid something, you said $100, $200, but do you have any idea what that total bill might have been that was sent to the insurance company?
So we have a health savings plan, and we have healthy kids. I'm pretty healthy, so I don't really. We basically pay. The deductible is extremely high. Mm-hmm. It's more like catastrophic insurance, is the way I like to call it. So I think our deductible is $1,500 a year or something like that per person. And so, long story short, that was a full in and out cost. If we would have gone to the hospital or it would have been a different story. It would have been $500 at least just for that one visit.
Yeah, at least if you'd have gone to emergency room, at least that much. And I think the reason I mention that is because I think it's important people get an understanding of the healthcare in America is just crazy expensive if you end up in a hospital. I don't know that we mentioned it on the blog, but my partner Mary Lou had a heart attack in March, and when she was she had the symptoms. I said, "It looks like you're having a heart attack." It was in the evening. I put her in the car and I took her to the local hospital that was about 4 miles away. Now, the next hospital was a full 12 to 14 miles away. The first hospital, I was able to get there in 6-7 minutes without driving crazy. The other hospital would have taken a full 30 minutes or longer to have gotten to. And so I'm okay. I don't know that she's having a heart attack, but I think she is. We get to the first hospital. I walk in. I tell them, okay, she's in the car. I think she's having a heart attack. They quickly come out, put her in a wheelchair, take her inside. I park the car, come back, do a quick check, and they said, yep, she's having a heart attack. And so they're like, okay. So then they said, we're going to get started doing this, and here's the process we're going to go do. They're explaining this all to her, and I'm listening in. And then they said something along the lines of, do you have insurance? And she said, yes, she has insurance. And so we said, okay, well, let's, we'll get started on that paperwork. Now, obviously, they're putting care first, and they're putting paperwork second. So they give her the nitroglycerin pill. They do some things, to help alleviate the situation as it is. Of course, the next thing you want to do in a heart attack is they go through your arm with a camera and they go take a look at your heart to see what's going on. And so they're talking about doing that when they come in and they said, oh, So you have insurance from this company. And we said, yes. I'm trying to remember now the name of it, but a very, very large provider. And they said, okay, well, we're not in that network. And so as a result, um, we're not going to do anything more. You're stable and you'll stay here until we can get an ambulance to haul you to their hospital. And that was the one that was, like I said, about 15 miles away. So she had to sit in the hospital for about 6 hours. She stayed in the emergency room area until they could get an ambulance that was paid for or part of the network that of the insurance company she's in. And then they took her to the second hospital where she could be treated. Now, the reality was that after she got to the hospital where she was treated, everything was taken care of, everything was fine, great care. And the cost was very negligible because, again, it was inside the hospital. But the fact that I took her to the first hospital, which was the closest hospital, cost her $5,000. And that was because that was the deductible limit on her insurance. And they said, well, you took her to an out of network hospital. And my thought at the time was, should I have been in the position of perhaps driving at an accelerated pace to try to get to an in network hospital? That seems crazy. I mean, it seems like you don't want to put
Yeah.
Adam in that position. And here I was 3 minutes, 5 minutes away from this hospital that I could check if she had a heart attack rather than calling an ambulance, which is a very expensive proposition. We don't even know if the ambulance is necessary. Perhaps she's just got something that's not nearly as serious as a heart attack. So the reality was, by doing what you would think would be the most obvious thing, going to the closest hospital, getting checked, confirming you have a heart attack, that things would be covered. But in the end, the fact was that the insurance is so screwed up in America that because that first hospital was considered out of network, she ended up paying the full deductible. Now get this, that 8-9 hours she spent in that first hospital cost more than $5,000. And
Right.
basically, all they did was diagnose her, do a couple of tests, confirm that she had a heart attack, and give her a nitroglycerin pill. And that cost over $5,000. So I think it's really a bizarre situation how this works when you do have an emergency and you do need somebody to take care of it. The second thing then is, related to this. A couple of weeks ago, I was on a holiday, and the holiday was in Vietnam. And as we flew into Singapore, then we went to Hanoi, and then we went to How Long, and then we arrived in Da Nang, and Mary Lou was feeling very, very poorly. And so she was feeling so poorly by the time we got to Da Nang that we went to the nurse at the resort, and she said, "Listen, I'm very uncomfortable with this situation, inability to keep food down, and trouble breathing and other symptoms. And with your history, they were pretty insistent we go to a hospital in Da Nang." And it turns out Da
Okay.
Nang. So this is the Socialist Republic of Vietnam. Truly, that's what it says right on your visa, Socialist Republic of Vietnam, right? But it turns out that there's the public hospitals and there's the private hospitals. And so we take her immediately to the private hospital, which could have, I got to tell you, it was more, it was a bigger and better set up hospital than the first one I took her to locally in the community in California. Right. I mean, it was very impressive going in there. They immediately started doing blood work. She was immediately met with a physician. She was able to be supported by a staff of people, all of whom spoke some English, so that there was good communication. She had, after all the blood work, she had an echocardiogram. She had her heart tested. She had X-rays done. Then, I mean, we spent a day with a full gamut of trying to see what we could find out to confirm that she did not have a heart attack, and confirm that she did have the flu, and confirm that she was very dehydrated and had some other symptoms, all of which they treated. And we left there. She had a couple of bags of IV put into her to deal with the dehydration, to give her some medicines. And then we walked out with a bag of medicines for her to take for the next week. And so as I'm leaving, they're saying, okay, you've been here. Here's the list. I mean, there's several pages, and these are all the tests we did. These are the physicians that looked at her test results. These are the nurses that worked on it. This is the equipment. These are all the medicines. You owe us $650. I was like, you got to be kidding me. This would have been a $15,000, $20,000 experience in the United States.
Right.
And it was a private hospital. And they were like, oh, yeah. And the doctor, the lead doctor that was dealing with her, gave me his card and said, yeah, if you need anything, for 24 hours, You've paid for all of our services. He said, if you have anything else come up, if she doesn't feel well, call me. I'll take care of it. Gosh, I would have felt like that I was in Denver, Colorado, the
Right.
way that I was so well treated. So I was very impressed with the level of care that she got, but I was also extraordinarily impressed with the cost. I mean, the fact that it was only $650 for a full day of care was rather remarkable. And it just reminded me, here was she paid $5,000 for a few hours in one hospital in the United States before being transferred and having the catheterization and getting the proper care. And here she was in Vietnam with the even more services provided, and yet at a much, much lower rate in a private hospital. I want to say that again. This was not a subsidized hospital from the government. This was a private hospital that focused on expats and mostly expats in Vietnam.
Yeah, I'm just it's astounding that, we have this healthcare system, which is it's sort of the combination of, really good healthcare, but it's going to come at a cost. I mean, if you look at some of these big hospitals, the king of Saudi Arabia comes and goes to does the whole gamut at some of these big hospitals, but he has the money to pay for it, right? So that's a very interesting experience you
Yeah.
had. We went to Mexico last weekend, the weekend before Thanksgiving, and had a great time. Stayed at a house on the beach, and some of us got a bout of Montezuma's Revenge. And so, we decided at the moment to actually order in some IVs to come and basically give some fluids to some of the folks that were sick. Luckily, my cousins are docs, and my other cousins are nurses, so we got all figured out. But I can't imagine not having. I mean, I can call my cousins anytime and ask them a question. I can't imagine not having that the direct correlation to a doctor that can give me some advice, some thoughts. I mean, the fact that I can't imagine you driving to the first hospital thinking, okay, is this in network or not?
Yeah.
That shouldn't even be in your vernacular. You should just see what's the best quality of care that I can deliver to my loved one here.
Yeah. No, I agree fully with you. I think this is what confuses people outside the United States. They're like, nobody else seems to have this problem, right? If you go to other countries, and then they say somehow it's because there's nationalized healthcare. Yet, they seem to do a pretty good job in the UK and in Canada and in France and Italy and Germany. We're not seeing people fall over dead of heart attacks in the street or feeling like they're completely, uncared for, and yet they don't have this problem. And on top of that, they pay less for drugs than we do because they have a central buying system in each of those countries, and they negotiate a lower rate. So it just gets to recognizing that the system that we have in the United States, the private healthcare or the private insurance system, is pretty out of date. And a lot of people don't realize the history of that was that if you went back to World War II, we had price controls, and we had a lot of, they were rationing rubber, they were rationing butter. It was World War II, and the government was really very involved in how we were taxing people and how we were trying to get the resources to fight the war. And they did something called wage price controls. So because there were shortages of everything and people were using ration books, it was an easy time that businesses could have just doubled and tripled the price of commodities or anything else they needed. So the government stepped in and they did price controls. Well, did they have price controls? They did wage controls, and they said, okay, we're staffing these the factories, but we've got a shortage of workers because so many men are offshore fighting in the war. To keep wages under control, they froze wages. So what happened was in Texas, an employer had this idea that he would come up with something called health insurance, and he would say, if you come work for me, you get this standard wage that the government allows, but I also provide health insurance. And that was the Blue Cross. They named it Blue Cross. And that was the first ever health employer provided health insurance. Of course, everybody today knows about Blue Cross and Blue Shield. It's a nationwide program. It's one of the larger health insurance programs in the United States. And the reality was that was born at a time of need during World War II, during wage and price controls. Of course, World War II ended. And what happened was employers kept providing health insurance. And, we went through this period with the boomers and coming out of World War II where people kind of thought they went to work for a company and worked for life. So, okay, if I want to go into Boeing or General Motors or these corporations and I go to work there, then I should be able, they'll pay my health insurance. And for all of the 1950s and 1960s and well into the 1970s, people just thought that was a norm, right? You got your health care covered by your employer. And by the way, they didn't have this pre-existing conditions clause in those days. So if you happened to change employers and you had a heart attack or you had diabetes or something, you were covered when you went to the next employer. But then as costs escalated, the employers started trying to control costs. We got into the pre-existing conditions. We got into the trouble of trying to change employers. And what we started to see by the 1980s and certainly by the 1990s was that the whole process of this employer-provided healthcare was layering a level of cost onto the employer that international employers don't have. If you're doing business in Germany or France, or you're in Canada or Mexico or Brazil, then what happens is the government is taking care of the insurance. So the taxes that are being paid in and the costs that are being paid by the people who live in those countries cover the healthcare costs. So the employer is not having to cover the cost of healthcare. And really, for employers to pay for healthcare is a disadvantage in the United States. They have to carry that extra cost. So we have an
Mm-hmm.
outdated system that doesn't work very well, that creates all these mobility problems. You can't transfer between healthcare sometimes without a pre-existing condition not being covered. And then we end up with things like these very expensive rare disease problems where somebody is one of 1,000 people. I'm sorry, one of 1,000,000 people to get something, and their health costs can run 10, 50, $100,000 a year,
Mm-hmm.
right? That's exorbitant. And the only people who can afford that are people with insurance, obviously. I mean, the private market cannot cover that cost. So then you start seeing all these people that are putting up these GoFundMe programs to try to get the money to do, a transplant, a kidney transplant or something,
Yeah.
because they've got some insurance or insufficient insurance to cover it. We're the only country in the world that has this problem. And it's just fascinating to me
Yeah.
because more people
It
don't want
is
to do something
bizarre.
about it. We made.
Yeah, it is bizarre, and you kind of bring up an interesting point regarding tenure in companies. And I was looking at some research or some numbers earlier. The average tenure of an employee in 2023 was, you want to take a guess?
I'm going to go 3 years.
4.1 years. Now, so workers that were
Okay.
aged 55 to 64 had an average tenure of about 9.9 years, while workers that were 25 to 34 had an average of about 2.8. So closer to what you were saying there. And then, so men had a longer tenure than women typically, 4.3 versus 3.9. And if you would just go back, I mean, when I was going through engineering school, some of my professors and my counselors, they were kind of still in the old school mentality. If you go work for Raytheon, or you mentioned General Motors, and you end up retiring there, right? You start when you're 22 years old, and then you get your turkey and your Rolex when you're 60, 62, and then that's it. And that's just the way it is, right? But things have changed a lot. And I know that you were talking about some things with General Motors here in our pre-meeting that might be interesting to talk about with our viewers.
Well, I think, yeah, we've kind of wandered through this space talking about healthcare to get to GM, but again, back in October,
Well,
what
maybe
we saw
GM needs a doctor.
yeah, we saw the strikes come to a resolution, right? Remember back in the fall, we were discussing um, how the screenwriters went on strike, and then how the actors went on strike, and then we had Starbucks people going on strike. We had casino workers in Michigan going on strike, and we had, of course, the car companies. They were seeing a strike from the UAW, and the discussion we had at the time was how the balance of power was shifting. That during the boomer years, if you go from 1960s all the way up through 2020, what we saw was generally there were a lot of workers vying for jobs, and either you worked for what you were paid or you got fired. And so the minimum wage never went up. It got stuck at around $7 to $9. It didn't go up. It didn't keep up with inflation at all. We saw employers being able to just fire entire workforces. Union membership dropped precipitously. All of that's what had happened between the 70s and the year 2020. But then what we're now seeing is a transition where employees have more power. And of course, the strikes have been much more successful, with the employees at the auto companies getting a 40% raise, right? Um, which is dramatic. And so we're seeing that power comes back to the employees. Now the question becomes, not only did they get that raise, but they also got better benefits. And just as an aside, in the state of California, they passed a law a year ago, which means that all the service workers in the state of California, I'm talking about people that work at McDonald's, right, and people who work at Jack in the Box and those kinds of companies, will now have a minimum wage of $22 an hour. In 2024, they're going to be paid $22 an hour. In the current environment, what does that mean? It means that the employer absorbs those costs, and then they either have to find some way, new efficiency, which means, okay, we're going to use robots, artificial intelligence, or another tool so that I don't use humans to try to keep my costs down, or I'm going to have to pass those costs along. So what are we going to see? Well, in a sense, what we'll see is more automated hamburger flipping. We're going to see more automated order entry. You walk into McDonald's, talk to a speaker, of the order generated. Perhaps some of the cooking will be done by a robot, and that's going to be to try to keep the cost down. Otherwise, your Happy Meal is going to cost you $15, right? So
Yeah.
these costs are what we're seeing is we're entering a period where costs of employment are going to go up, and healthcare is one of those costs of employment that people need to be concerned about. And if I take a look specifically at General Motors, again, as we were ending the fall, one of the things that I pointed out was that their autonomous car project called Cruise had been going on for 2 years in California, and they had so many accidents that the state of California reviewed the data and discovered that GM had not put all the data honestly in front of the regulator. And so they found them in violation of their data, as well as having a discernible large number of accidents that had caused various problems. And they said, okay, we're going to take away your license. So the automated car license that GM had to operate their Cruise robo-taxi service in California and specifically in San Francisco, they lost that in October. And I thought that's a bad sign, because the future of the auto industry has got to be around electronic
Yeah.
vehicles leading towards autonomous electronic vehicles, right? Well, now this week, what do we see? They say, well, we lost $9.3 billion because of the strike. I wouldn't be too worried about that. Again, that's in the past. They always talk about what's the future. The fact that you lost some money in that period of time doesn't reflect what your future is going to hold. But what they then said was that, well, we're going to raise the dividend by 33%, and we're going to put up $10 billion in a stock repurchase program, which at the current price of General Motors stock would mean they're buying back 25% of all outstanding shares. That's an enormous stock buyback
And
program.
what's the strategy behind that?
Well, and then the third thing was they're stopping or cutting back to eliminate the Cruise program. So now, what was your question again, Manny?
What's the strategy behind the stock buyback?
Well, I think in the short term, investors, what they're saying to investors is, hey, look, we got cash. We're going to hand that back to the investors. So we're going to buy shares and we're going to increase the dividend. We're giving money back to the investor. And that, of course, creates an initial pop. But if I was an employee of General Motors, or if I worked in the state of Michigan, I would be very, very worried, because basically I would say what they've announced is a liquidation program. They've said, look, we don't know how to deal with the robo-taxi autonomous car part. We're going to shut that down. We have now renegotiated with all our labor, our employees. We're not, and I don't see a clear plan, their path forward with the EVs, where they intend to go, how they intend to compete with Tesla, Ford, Nissan, and companies out of Europe, and also out of China. So there's no discernible plan that's laid out on the table. They didn't announce, here's how we're going to be a winner in EVs. Instead, they said, we're going to start taking the money in the company and giving it back to the investors, which is liquidation. If you're either
It doesn't make
investing
any
in
sense.
growth, which is like EVs, and then you're saying, I'm going to put my money there and I'm going to be able to grow my revenues at 15%. I'm going to make more money, and in the future, my investors will get a lot more money. Or you say, hey, I'm giving up on the future and I'm just going to liquidate the company by buying back shares and handing out a big dividend. So I think that's how people need to interpret this statement from General Motors, is that they are very, very weak right now. They don't seem to have a plan for the future, and they're starting to liquidate their assets.
Yeah, that's unfortunate. I mean, they've always been, at least in their early years, they were the paragon. I mean, they were at the apex of the food chain as far as, I mean, obviously Ford came in with the assembly line and all that. But if you look at the 40s and 50s and 60s and even in early 70s, GM was the king. Chevrolet, Buick, Pontiac, and of
Oh
course
yeah,
now they're on the ropes. You know.
their suite of brands had over 50% of the market. They were bigger than Chrysler and Ford combined. And there was a famous phrase: "As goes GM, so goes America." Saying that when cars were selling well, it was good for the country. And now people don't talk that way, right? In fact, we're all sitting around wondering who's going to be the dominant car company. Is it going to be a Ford who's investing heavily in electronic vehicles and paying the price with very low earnings? But they're trying hard to get into it. Are they going to be able to fight the battle and come out the other side? Will Tesla continue to remain the leader in the market? They certainly have the share now. They have the highest volume. They have the most R&D. They have the most patents. They have control of the charging devices now. They're all going to be standardized around the North American standard that Tesla put in place. So is Tesla are they unbeatable? Are they out there in sort of an Amazon, Google kind of market position where nobody can catch them, right? Or is somebody going to come up, like Baidu, somebody coming out of China going to come in here with a new product that's going to be lower cost, or somebody from Europe, like is Mercedes or BMW, going to find a way to take on this Tesla domination? We don't know.
Yeah.
But what I would say is that right now the only American car company is Ford that's investing in it. We don't see a lot coming out of Stellantis that owns Chrysler and Jeep. They've not shown a strong plan for EV development or autonomous car development, or even trucks, or even in heavy trucks.
Well, they
right?
did come out with a new plan for a truck that's actually, it's a hybrid electric that might be interesting. It's the new Dodge Ram 1500. I'd like to see where that goes. But you're right. I think there's a lot of when we see these giants sort of on the ropes.
Yeah.
Blockbuster was on the ropes and then they fell. Toys R Us, all these other companies, Sears. I hope that the GM finds a way to really get behind these trends. I mean, we talk about trends all the time, and execution. You can't just talk about stuff. You have to actually put your money where your mouth is.
And the Dodge Ram 1500 hybrid vehicle is a great idea, but it's sort of 10 years late, right? Remember when we started having Toyota Priuses? That was a long, long time ago, right? That was 15 years ago that we started those hybrid vehicles. And today you have the Tesla says that they're going to finally get their truck on the market in 2024. They had predicted it for 2021, so they're obviously quite late, but they said they're going to have it out. They have pre-orders of something like 400,000 vehicles on that truck. We've got the Ford Lightning F-150, and then Rivian, who's struggling. They're selling every car below cost, but they seem to be financing. Remember, Tesla sold a lot of cars below cost before they got to break even. Rivian is definitely in the marketplace. They're definitely selling a lot of vehicles and could be positioned to continue, if they can continue to raise money, to fight the good battle here. So to be coming out with these kinds of products now is a decade late. And just kind of, I feel like you can sit back and say, what has GM done for the last 40 years to try to maintain itself? And I'll never forget the first Tesla article I wrote, which was in 2010. And I said, that it was going to be a very successful company because it was not looking at why it couldn't develop EVs, but instead looking at how to overcome the obstacles to EVs. And at the time when I wrote that for Forbes, people at General Motors wrote reactions to what I said. They wrote columns for Forbes. They wrote comments on my thing saying that I was an idiot, that Tesla would be crushed, that just like DeLorean was crushed, you just can't do it. It won't happen. No small company can come from behind to try to catch these things. And the industry at that time, 2010, was wildly and loudly opposed to electric vehicles and saying that it was just never going to happen. Well, now we've waited too long. It's 2023, almost 2024. And I think we're seeing abdication on the part of General Motors saying, hey, we lost. We couldn't fight back the strike. We had to give in. We got to pay these workers a lot more. And I'm not sure that the board or the leadership has a future in plan now for how they're going to come roaring back and how they will be highly competitive. But I think all that, again, trying to kind of sum it up a little bit as we end this, is that we do too much thinking about today and how we're going to get something done today, and not enough thinking about the big picture. I started writing about healthcare costs more than a decade ago on my blog. I wrote about it with Forbes. The way healthcare costs are so expensive in America that it's a drag on the economy, but it's a drag on employers. And until the Obamacare set out to address that for reasons that are really inexplicable to me, corporations fought that idea. They didn't like the idea of going that direction. And there are certainly individuals who somehow seem to think that if you allow the government to have a voice in buying services and providing services, it's going to create a really negative problem, despite the fact that low globally everybody else does it quite well. But if we don't make some changes, if we don't start looking at these global issues that include costs of healthcare, that include costs of employees and higher wages due to demographic shifts, then it's going to be tougher and tougher on employers, especially traditional employers. And it's going to force far more innovation, far more use of robots, and far more use of autonomous business processes, as well as artificial intelligence.
Very well said, Adam. Very well said. Well, welcome back, and excited to finish up the year with some additional podcasts. And we've got some exciting things to share with you about next year, some new products and services that we'll be offering. And so with that, Adam, have a great rest of the day. Welcome back, and we'll talk to you later.
Thank you, Manny.
Cheers.